Dr. Alan Morrison, thank you so much for joining me today.
Thank you.
Can you describe first what your practice was like before you started on a journey with concierge medicine?
Well, sure. We had a thriving, busy, exciting, action-packed, solo, freestanding, independent internal medicine practice that had been built over probably the previous 13, 14 years. Plenty of patients, but very little time to see them. So we were actually doing extremely well. In fact, when I sat down with some of the concierge companies over the years, the numbers looked just fine. And the question was, why do you want to go into concierge medicine? Your practice is thriving. And my response was, there's just not enough time to see folks. We may be doing well here, but and we're still alive in a world of corporate medicine, but it's not sustainable. And that's when I started looking into and continued to look into partnering with a company to go into concierge medicine.
So why did you decide to ultimately take the leap into concierge medicine?
Well, it was time. Like I said, we were running a very busy, thriving, active, exciting general internal medicine practice. And the only way to go to sustain that was to keep seeing more and more patients every day. And that was not a sustainable model from, it may have been sustainable on paper from a dollars and cents standpoint, but from a general well-being standpoint and being actually able to practice the kind of medicine that I want to practice, which meant taking more time with folks, it was time to make the change. And over the years, I had explored the options, had talked to other folks over the years, other docs who had made the transition, other companies as looking into other models. And nothing really resonated with me until I learned about Castle Connolly Private Health Partners.
Can you talk a little bit about the benefits you've experienced? Well, I guess to start off, first tell me how long you've been doing concierge now, and then talk a little bit about the benefits that you've noticed.
Well, I think it was probably about, it was probably about the summer of 2018. I got a postcard in the mail from a Castle Connolly Private Health Partners, and I looked at it and said, I don't know these guys, and I threw it away. Then I got another notice from Castle Connolly Private Health Partners, and I went, I don't know these guys, but maybe I ought to check them out. So I checked them out. And it didn't take long for me to realize this was a small company. This was people who were dedicated to what they were doing. It wasn't corporate in the way that they did business. And I felt very comfortable as I got to know the folks at Castle Connolly Private Health Partners that this was a perfect match, not only from a business standpoint, but from the offerings that were there that I had not seen in the past. Some of those offerings were technology. We were doing, I like to tell people these days, we were doing telehealth before telehealth was cool. That's always been part of the model. So along with that was health coaching and the benefit of having a personalized health coach who can help you meet your health goals, from weight loss to sleeping better to dealing with anxiety better, just someone to help you along and coach you on a regular basis. And that was not something I heard anywhere else either. It was very appealing to my style of practice. And the folks who are active in the practice now are really seeing those benefits. So but going back to the...
Yeah, I was gonna say, can you describe just like the daily, like how is like the sort of the feel of your practice, how you interact with your patients, how has that changed?
Oh, well, it's night and day. I've got time now. It's a little difficult to compare apples to apples because they're not. I mean, they're completely different than a concierge practice is not the same as a volume-based practice. There's time to talk to folks, not just in the office, and particularly as we moved into our COVID era, I don't know how having thousands of patients on the books would have worked, as opposed to having a whole lot less than that on the books to communicate with people remotely. Because as you know, we've gone completely remotely for a very short time now. We're integrating people into the office very carefully. But when COVID hit, we were ready because the video conferencing was already in place. People already had my personal cell phone number. People already had my direct email address. People were already connected on our electronic medical record so that they could message the office. We were set, and it worked. We just, from an operational standpoint, we had things to deal with here in the office and as COVID was concerned. But as far as communication, Castle Connolly had that all set up already.
What was the biggest challenge that you experienced during the transition from a traditional practice to a concierge medicine practice?
Well, there were several. As far as challenges are concerned, it's a huge leap of faith going from what you're familiar with, what you've built over the majority of your career over, in my case, over a 13, 14-year period of time that followed an original career in academics. So looking at 20 years of practice and saying to yourself, okay, I'm going to risk it all. I'm going to roll the dice and see if people are going to do this. Well, you're counting on that relationship that you have with folks to be that glue that keeps them connected. And some people value that relationship and see the value in staying on with a physician like myself. Others don't. And I totally understood that. But a personal challenge in there was getting to the point to understand that, because frankly, and it's not something a lot of people talk about, but there's a lot of rejection involved in going into a concierge medical practice, a lot of rejection, and learning that it's not a personal thing. It's people are making decisions based on what they value and how they handle their healthcare. And I respect that. So we had to say goodbye to a lot of people who didn't want to stay on board, which was difficult. That was a challenge. But little by little, even some people who initially said no, ultimately said yes. In fact, now a year and a half later, we're seeing folks who initially said no saying yes. So the door is not closed. We've kept it open. We actually last month saw an incredible spike in memberships. I think people are coming out of the summer of COVID and realizing I need a doctor who I can actually call, who I trust, who I know, who I feel comfortable with. And luckily they're remembering me.
If you could do your transition over again, what would you do differently?
Gosh, I don't know that I would do anything differently. I think the process that Castle Connolly Private Health Partners has laid out is excellent. They've got tools that are at your disposal for connecting with individuals if you want to use them or if you don't want to use them. The main ingredient for me, at least in my opinion, was having the right member advisor here on site helping with the transition. And they found the best member advisor, in my opinion, who could have possibly been hired to do the job, who's still leading my practice with memberships. And just so happy to have her as part of our team. They made it happen, but at the same time, there's a huge investment on the physician side of things to make it happen. I couldn't just sit back and say, okay, you guys do the work, sign everybody up. I don't think it works well that way. I found myself making phone calls on a regular basis just to engage folks, maybe 5 a day, 10 a day, just to say, hey, where is your head at? Let's talk about it. Let's talk about this transition. What are you looking for? Let me explain it to you a little bit more. It was a huge investment of time on my part, not just on the company's part. It really is a partnership.
So, we hear all the time at Medical Economics about physician burnout and being on the hamster wheel of sort of practicing medicine today. And I'm just wondering if this change has had any impact on, your career satisfaction, or sort of like if it fulfills, how, what you imagined when you went into medicine in the first place.
Totally. I'm off the wheel. Um, I can say that confidently. Now, I wish I could say it even more confidently if we weren't in the midst of a global pandemic, because I really would be practicing the way I want to practice, which would be sitting in the office with folks with that hour exam that I promised, hour physicals that I promised them, with coming into the office and being seen for even follow-ups for half-hour visits, as opposed to zip, 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 get in, get out. We've adjusted. So I can't say 100% that it's exactly what I envisioned. It was for a little while. Getting back to the timeline, once I interfaced with Castle Connolly and made the decision to come on board, we announced our decision to make the transition in February of 19. We launched in May of 19. And so through the summer of 19 into the fall of 19, we're practicing, and our numbers just absolutely plummeted, which was so great to see. It's so counterintuitive for a volume-based practice to see your schedule go from 30 patients a day to 6, 8, maybe 10. That would be a lot of people in a concierge practice, in my opinion, to get it done the right way. Now, these days, we've moved to doing video visits before people come in for physicals, so we can actually spend our time wisely, efficiently, not rushing anybody, but keeping them here not longer than they want to be, and not longer than I want them to be. As far as career satisfaction is concerned, it's off the charts now. I'm much happier than I used to be. And I'm not only just happy with the time I've got to spend with people here in the office so that I can do the kind of job I want to do as a physician, which is really not just the nuts and bolts of medicine. It's really the building the relationships of medicine and getting to know people. And you can't do that in 5 minutes, 7 minutes, 10 minutes when you're trying to get to the next patient or thinking about the 2 or 3 other patients in other rooms. So career satisfaction is definitely off the charts. I'm going to take up some hobbies because I have so much free time now. But at the same time, I also manage our practice from a business standpoint too. So, unfortunately with the COVID pandemic, everything has been turned upside down. We've turned our practice upside down in terms of providing the best service we can with video, with pre-visits, with phone calls before people get here to know what they are going to be doing here while they're here. And unfortunately, we're not spending that time in the office, but we are spending it together, and we're able to do it by phone, by email, by text, by FaceTime, by video visits, in the office. It's the whole gamut. And having less people to do that with is definitely more manageable than as a solo, independent, freestanding physician than I could have been able to do it with thousands on the books.
So my last question is what advice would you have for other physicians who may be considering concierge?
Well, my advice for other docs considering a concierge practice is to find the right partner, to know who's out there. And if that right partner is doing it on your own, then doing it on your own is the way to go. But it's certainly a way to stay independent in a world of corporate medicine. It's a way to be able to be yourself, to practice the way we were trained to practice, I believe, to have relationships with people in a in the less clinical way possible, that not in a big corporate hospital type sterile setting, but in a friendly, warm atmosphere of a general practitioner's office. That's how I envision practicing, and that's how I'm practicing now.
Dr. Alan Morrison, thank you so much for joining me today. I really appreciate it.
Thanks for having me.